activist is to make sure you're talking to your neighbors and friends and coworkers about what this bill really is, because there is just so much misinformation about it. And people are scared. I mean, we know that because of the economic conditions we're in right now, folks are very nervous about their future, they're fearful, and something as personal and as intense as healthcare, it goes to the very core of that. And so it's easy to put out misinformation to get people very worked up about it. So it's very important to get those facts out. And the way I describe it out there is this is about, certainly it's about folks who don't have insurance now, that's very important, but it's about everybody who has insurance as well, because the costs continue to rise at a level that's just unsustainable. Soon none of us will be able to afford it if costs continue to go up. We've seen that recently here in Michigan. You've seen those rates in healthcare companies across the country. In Michigan alone, since the year 2000, health premiums, insurance premiums, have gone up 17 times faster than wages. Now that's not sustainable. It continues. And the folks that we talk about, particularly here in Rochester, where you've got a lot of small business people, the folks who are impacted the worst are those people who are in small businesses, whether you work for one or if you own a small business. And I know there's some small business owners here that deal with that. And if we look at how we're going to have a renaissance for Michigan's economy, I mentioned the auto tech, but it's really about small businesses. And small businesses hire most of the people. We're not going to get a Fortune 100 company moving into Michigan. It's going to be a lot of small businesses creating jobs. And yet if you're a small business person right now, you try to go out and get health insurance for yourself and for your employees, it is extremely expensive. In fact, it's anywhere from 30 to 40% more expensive, your premiums, than a large company if you're buying insurance. And if your employees who work for those small companies have deductibles roughly double that if you're working for a large company. And if you're an individual, it's very expensive to try to buy insurance, so it's cost prohibitive for most individuals by themselves. And so the Health Reform Bill, a key component of it that I encourage you to talk about with your friends and associates is the insurance exchange that's created in the House version, and I'm still waiting to see what happens when we try to merge this with a Senate version. I don't think the Senate version is as good as what we do in the House when it comes to an exchange, is that you got to have a much more robust insurance market than we have right now, more competition with insurance companies. You know, in this state we've got one insurance company that has nearly 70% market share. That's not competition, that's called monopoly in most cases. And in other states around the country, it's even worse than here in Michigan. So you need to have more competitive, and you've got to price it so that regular folks can afford it, and that means more competition in that marketplace. So when you hear the exchange, which is part of the bill, the exchange is a place where you would go if you're an individual who doesn't have insurance, or if you're a small business person, you want to buy it for yourselves and for your employees. The insurance exchanges are made up of private insurance companies that are competing, but competing against each other in a very transparent way. You can see the prices. It's going to be very aggressive competition. It'll be around the country, at least in the House version, around the country, national. And so you would buy into an insurance plan that has 1 million people in it. So you're not going in as an individual, a pool of one, paying really high price. Or a small business with 20 employees, a very high price because you're a small pool. Now you can buy into the rate that a General Motors or an IBM would get because it's a very large company. So you get that significant cost advantage of being in a much more competitive marketplace and aggressive competition. And that's about holding down costs for everybody. People who have insurance now, folks all through this town, and your neighbors and coworkers who are a little uncertain about the insurance, and let them know this is about having more competition and bringing the prices down, squeezing the margins, particularly from insurance companies. The other part of the bill that's very important is really kind of transforming the way that we pay for health care as well, and focus on instead of paying by procedure and every surgery you have and every procedure you have, instead paying on a healthy patient at the end, and rewards and incentives for that. Because right now we have a system that is way too expensive because it is based by the procedures and surgeries. And guess what? When you pay by procedures and surgeries, you get more procedures and surgeries as a result of that. And a study that has really informed me as I'm thinking through this healthcare debate is from the Dartmouth Institute, Dartmouth University, that looked at healthcare spending across the country. And what it found when it looked at Medicare spending and what we pay for seniors and Medicare around the country, and it found there's a very large disparity depending on what region of the country you live in. We spend a lot more for seniors in some parts of the country relative to others. And then it looked, after looking at that difference, it then looked at the actual health of the people. What is the outcomes from going through that healthcare system and coming at the other end? And this is what was most interesting. Those areas where we spend the most money, the people are the least healthy. There's an inverse correlation to it. Or they're not any different. Either they're not any different or they're at least healthy. And it shows that, the idea of medicine is about wellness care. It's about looking at healthcare and trying to give as much, the minimal amount of treatment that you need to get healthy and no more. You shouldn't have more surgeries than you need. If you only need one surgery, you should only have one surgery, not 2 or 3, the things that aren't done. And so that is where it's important to measure that quality. And there are examples of that around the country. In fact, here locally, Henry Ford Hospital has a program that really works where they incentivize their physicians based on the health of the patient, not by the number of treatments they're doing, and they get incentivized based on health, not cutting care, but on health. And they're considered one of the top systems in the country, and they do it at a cost less than average hospitals. So it can be done, it is being done, and it's about really reforming that kind of healthcare. Then you've heard other examples like the Mayo Clinic and others were examples of that as well. First-class quality healthcare, but at prices less than the average hospital. So right now in those bills, those are pilot programs. Hopefully we can move that forward. But ultimately, this healthcare reform, I look at it, it's got to be about having more competition. It's got to be about making sure it's affordable, making sure that everybody has the opportunity to get into the system and have an affordable system that covers everybody in a system that works for everyone. And if we do that, we can also, you hear a lot of opposition to it because it's going to cost too much, it's going to add to the deficit. We've got to make sure it's paid for. But we cannot deal with the federal deficit if we don't control healthcare costs. Big share of what the federal government spends every single year is on Medicare, it's on Medicaid, it's on the VA system. We've got to deliver it more efficiently or we're not going to be able to reduce the deficit. So this is an important issue. I think it's important for us to be out there talking about it in those ways. I know there's a strong commitment in the House caucus where I'm in is to move something forward. And we'll see what happens in the next couple of weeks. So already hands are going up, so we'll go to the Q&A section. I didn't get questions on the other two in healthcare. What's with that? Yeah, Patty.
The thing that I get, I'm a big supporter of the healthcare plan and have been from the very, very, very beginning. And I talk it up a lot, and one of the things that has, I'm getting a lot of resistance is the confusion over the Stupak Amendment and the version in the Senate. And I try to explain that government money is not going to go pay for abortions, that's dealt with the Hyde Amendment. But then it becomes so complicated. Can you give me a nice 3-sentence way to explain that? And if so, I'm nominating you for genius of the year. No, but there are people who are buying, they're saying, no, we will be paying for abortions. And it's the confusion, and you try to explain, well, they'll have to have split policies and swapping, and it's so complicated. Is there a nice little way I can do it simply?
Well, it's there isn't exact, so I won't get genius of the year probably.
Sorry.
But you're right. There wouldn't be federal money for abortions. The Stupak Amendment goes beyond that in the fact that in this exchange, this insurance exchange, the original language in the House version was that in the exchange there needed to be, people would have a choice. And these are private insurance companies that are offering it in the exchange. And if it was national or if it was regionally broken down, that there would have to be a policy, people would have a choice. If you wanted to buy an insurance policy that did not provide abortion services, that would be offered. But there would also be a policy that did offer it. So there has to be at least one company that provides with that coverage and without that coverage, and then consumers could make the decision as to what they would do. What happened was that in the Stupak Amendment is that part of the exchange is that for affordability, so everybody can afford the insurance. So even though you're going in the exchange, it should be cheaper prices because of the competition. There are also affordability credits for folks depending on your income. I don't have the numbers, it's going to change with the final version, but depending on your income, you're capped at how much you pay for health insurance, and if the cost of insurance is greater than that, then there's a federal subsidy to cover it. And so the Stupak Amendment said if there's a federal subsidy involved for any policy, then it cannot offer abortion services. So that would mean basically private insurance companies would not offer it because they're going to be in the exchange and they're going to want, they're going to be part of the subsidies because most people are going to need subsidies, or a lot of them will need subsidies to help pay for it. So it would expand it so that even private insurance companies, which now many of them do provide abortion services to women who need that, that they would not provide it anymore.